Hello and welcome back to Focus Atlanta. Thanks so much for continuing to watch. We're going to close out the show talking about something very important, and that is health disparities in Black women. I am here with Dr. Wyland Wilson.
Thank you for having me. It is a pleasure to be here.
This is such an important topic. When you were writing, was it when you were writing your book or when you decided to write your book? Like, when did when did that burning, nature come and say, you know what, this is something that we need to present to our women?
Yes. So actually, it started a really long time ago. So I was born about 10 years after the desegregation of hospitals, right? And so we talk a lot about, desegregation of our educational institutions, of public facilities, but we don't talk a lot about our Jim Crow healthcare history, right? And so because of that, I grew up hearing horrible stories from family members and other African Americans in my church and community about their suffering within the healthcare system. They're feeling unheard, unseen, uncared for in an institution that was focused on cure, but where care was lacking because of that, combination of race and health.
For so many Black women, they feel unheard when it comes to healthcare, right? They feel like what they're saying is not really being understood when it comes to their physician. Sometimes when, if it's an emergency situation, from the emergency room, like at what point, is there anything that women can do to really bolster their voice, so to speak?
Yeah, so it's a real problem. In fact, Tina Sachs wrote a book about this very problem among African American women. And it was interesting because as I was reading her book, it's called Invisible Visits, right? And so she's looking at Black women and our coping behavior. So the things that we do, we'll kind of dress nicely, professionally before going to a doctor's appointment. We'll wear our name badge or anything kind of signifying that we're of a middle class or whatever. And when I was reading, I was like, oh my gosh, I've done all of this, right? Because of the fear of being taken for someone who doesn't know, right? We shouldn't have to do all of these, I call them also mental calisthenics that we do before going to a doctor's appointment. Like, how am I going to signify that I know what I'm talking about? And, we should not have to do that. But one of the things I do tell women is that one thing that's important is everybody actually should have a healthcare advocate. So if you can, take someone with you, because if you're going in for an appointment, that is a very vulnerable place, right? When you're sick, you're not feeling well. And so if you're able to have someone with you, it will be wonderful. And I try to, encourage people, please be someone's, accompany someone to that healthcare appointment, because they may be kind of nervous about, okay, what is the diagnosis? And you can be the one taking notes. And you can be the one, after you've asked permission of them, to ask questions that they might not want to ask because they're nervous or something like that. But yeah, that's one of the things that I think is really, really significant for women to do, but also to know your rights as a patient, right? And that to know that, yes, you have the right to ask questions, to ask for a second opinion, to interview. I actually interview my healthcare providers before I actually select a doctor. I'll say, hey, look, I have an interview that I do. I have a list of questions that I need to ask you, and I need to know, are you okay with that? And their response actually will tell me whether they're going to be my provider or not. Right?
Okay. Yeah. That is a fantastic way.
Like that.
Yeah, fantastic way to go about it. Well, then I can't let you get out of here then without telling us how to get the book. Is it available? Can we go to your website?
Yes, you can. Please do go to wylandwilson.com. And I also have resources there as well. So you will have a link to the book, but there's also resources for Black women's health. And Black women's empowerment and spirituality. So hopefully it will be something that you will find useful when you visit the website as well.
Thank you so much for making time for us. Thank you for, you know what? Thank you for doing the work. Thank you for looking at this issue and saying that it was worthy of doing the work. You're a very busy woman. You didn't have to do it, but you did. So thank you. It was a pleasure to meet you.
Thank you. It was such a blessing to be here. I appreciate you greatly.
All right, guys, please take the opportunity to go to the website, get the book, and you know what? Find out the questions that you should be asking. You are the biggest advocate of your health, and we shouldn't be afraid to ask the questions that we need to ask. We shouldn't be afraid to put ourselves in a position of vulnerability with our physicians. Take the opportunity to go to the website, learn more, learn how we can all be better advocates of our health and health care. Thanks, guys, for tuning in to this week's episode of Focus Atlanta. I hope to see you next Sunday here on WUPA.